Hi, class. Let's take a look at another part of the integument system. We spoke about the skin before. Let's look at the nails. The nails are made up of keratinized epidermal cells. And there's a few important structures. This part that we typically clip, that's the free edge. We have the nail body, right? This should be pink in color. We have this part here, the lunula, which is white. Then we have the cuticle known as the impontium. And then back here is the nail root. And there's matrix back here. So when we look at it from the other view, right, we're taking part of the fingernail up here. So we can see the free edge. We can see the nail body should be pink. We can see the lunula. We can see the cuticle or the impontium. And then we can see the nail root. This is the part here that's not really visible, but behind it is where we have the matrix. This matrix back here is the epithelium that's proximal to the nail root. And it has these stem cells, these dividing cells. And when they produce, it's kind of like how skin starts at that basal layer, and then it moves up to the corneum, stratum corneum, where it sloughs. It's just that the nail moves in this direction. So we have dead cells that we cut at the free edge. Okay. Now, this part here, that's your nail body. This part back here is the nail root. Now, what's clinically important about this, right? Part of my physical exam, when I meet with my patients and I shake their hand, I turn over the hand and I look at the nails because it can pick up so many diseases, metabolic diseases and autoimmune diseases. In this particular case, it's typically some sort of COPD or advanced lung cancer when we see clubbing. When we start to see thickening around the cuticle and it really starts to push down in a clubbing type of deformation like this. Very, very thick cuticle. This is called clubbing. It's typically seen with decreased oxygen or COPD or heart disease, but it's also seen with inflammatory bowel disease. Okay, very, very common, or with cardiovascular disease. When we look at the nail beds and we see that these are very pale or white, it's anemia, right? Your red blood cells carry hemoglobin, and hemoglobin, the heme portion, is iron. And iron binds with oxygen. Okay, so if your decreased red blood cells are decreased in iron and you have anemia, you're going to see this white. Decreased oxygenation can be seen with heart failure, can also be seen with liver disease or malnutrition. Okay? Can also be seen with a B12 deficiency or an iron deficiency. Now, this right here, if you have, I typically see this in darker complexion individuals. I had a patient with this last year where you see this streak, looks like of melanin right down the finger line. This right here, it could be a form of skin cancer called subungual melanoma. It's a dangerous type of skin cancer. So if you see this, please, please, please get it checked. Now you have this type of appearance where it kind of looks like this candle wax dripping down the nail. This is associated with typically endocrine disorders, endocrine condition, very commonly diabetes mellitus. Can also be seen with thyroid disorders. So diabetes and thyroid are going to show this type of candle wax dripping. Okay?